All right. Hello, everybody. This is our new and improved version of Take Action Tuesday, where we are going to be able to have a real good conversation with Dr. Todra Anderson-Rhodes. I'm super excited to have her here as we talk about the impact of the Delta variant on the minority community, and then what we can do about it, right? Take Action Tuesday, so we got to figure out what we can do. So, Dr. Todra, can you kick us off and introduce yourself?
Absolutely. Thank you, Natalie, for having me at Take Action Tuesday with the YWCA. I'm very pleased to be here. So I'm Dr. Todra Anderson-Rhodes, and I am the Chief Medical Officer at Memorial Hospital Miramar in the Memorial Healthcare System. And I have been in this battle with our teams. I lead everything regarding our physicians, and obviously during this COVID pandemic, operations, et cetera, with our administrative team for now the last 18 months. So I know that people want to know, well, how do you know about COVID? Well, we've been living this for 18 months. And so we're here really to share our story and also to help the listeners and our community to really help us to take action.
Thank you. And thank you for your hard work. It's been a long road. 18 months is a long time. I think when we kicked this off, we didn't really expect it to be this long. Kids were rushed home, and then, okay, we'll get over it this summer and we'll be back for the next year. And then that didn't quite happen. So same thing again. We were supposed to rest the summer and be back. And so
exactly. It's been quite a challenging 18 months, but we are committed to our communities, committed to our staff, our people, and really trying to do the right thing, not only for us, but for everyone. And so you're right. It's very different in terms of what we thought it would be. It's unfortunate that we are here where we are now, because we know now where we are is largely could have been prevented. Whereas 18 months ago, when we just started in this pandemic, we really didn't know what was going on or what was going to happen. And we were sort of all in it together because of, the fact that we were just learning about it. I've likened it to, and we've spoken before, we were really, we were in a sprint in the beginning, like, oh, what do we need to do? How can we help people? How can we protect people? And we really just went off to the races to really do that. As this has now waxed and waned, and now we have the Delta variant, we recognize, as you noted earlier, it's really more of a marathon. We're going to be in this for the long haul. We know that we have the Delta variant now. There are other variants that are out there, unfortunately. So we need to do something. We definitely need to be proactive and take action, not only to protect ourselves, but to protect our loved ones, protect our community, protect our globe, really.
No, that's definitely true. And something you said a little earlier about the how smart this virus is. And so can you speak to that a little bit? As we sort of hear different things at different times, and why is it changing? Why are we getting sort of these different messages throughout this 18 months?
That's important, Natalie. So, viruses in general tend to be pretty smart. They recognize that our bodies are trying to fight against them, but they want to be inside of a host in order to continue to perpetuate themselves. And so they do have the ability to make even small changes that then prevent our bodies or our immune systems from recognizing them as, let's say, the original or the novel. So that's why we talk about the novel coronavirus 19 being the original, and then all of these different changes subsequently are variants. They're variety of the initial one. But what happens essentially is because, we didn't all get vaccinated. We didn't have enough herd immunity. You've probably heard those terms before. And so the virus says, okay, well, some of you have it and some of you don't. So it tries to outsmart us. And in this case, with the Delta variant, it really is trying to succeed in doing that. And so because enough of us were not immune enough, it was basically did these changes, and our bodies really have a harder time fighting against it. One of the things that I've learned about the Delta variant, particularly, it's about 1,000 times more potent than the original coronavirus. And what that really means is, for those of us who are young enough to remember what chickenpox was like, if somebody in your household sort of got chickenpox, everybody would make, you go around those persons and then everybody would get chickenpox, even if you didn't touch them or whatever. It was that what we call virulent. It was that effective. And so we now know that this virus does similarly the same thing. So whereas before, let's just assume in a droplet, there was, let's say, one particle. Now you can imagine one droplet has about 1,000 particles. So it's much easier that if you're exposed, number one, that viral load will be higher, which makes it harder to fight. But also it's like it gives it that extra strength, unfortunately, for that variant. So that's really important. And the other thing about that is that I've been telling people, it seems as if the medical community to some has been given misinformation or changing information. But just as I described, that as the virus changes, right? It was the original one, then there was Alpha, then there was all these other variants, and now we're up to Delta, and unfortunately Lambda's following. Mm-hmm. Each time we have this change, we need to sort of course correct. And so this has been a very fluid situation, as my partner, my chief nursing officer, Alberto, likes to say. It's been a very fluid situation. And so the information that we gave in the beginning may not be valid, down the road. The information I give out today, some of that may not be valid in a year's time. We're hopeful, though, that by everyone taking action, really considering and then going to get vaccinated, and of course, following the CDC's guidelines, that those will be things that will help us to really battle this current variant.
Well, thank you for that. And so when you say about this viral load, I think like originally like, oh, if you're not in the space for like 15 minutes, then you'll be fine around other people. And so I feel like that time period has kind of dropped a little bit. It's 1,000 times more virulent.
Yes. And so for a lot of different reasons, a lot of our recommendations have changed. Number one, again, Delta variant, it's newer. So we know less than we know about the novel, right? Coronavirus, where the original recommendations were made. Because we know that this is so much more virulent, so much more effective in really affecting people, we really want people to take care and really just monitor your surroundings. You definitely need to make sure you're physical distancing. Minimum 6 feet farther away is better. We also want to make sure, so I have my little sign here. So we want to make sure that everybody recognizes that you still do need to physical distance. And it's okay if you're in like Publix, Winn-Dixie, whatever you're. If people are too close, I just sort of look at them and I, my little, do you mind stepping back? I'm nice about it, but I'm firm about it because I want to make sure that I have my space. I also want to make sure that people are washing their hands. And, unfortunately, soap and water, there may not be soap and water in every restroom that you might have to go to, but please keep your hand sanitizer with you that has at least 60% of alcohol in it, so that you're constantly, I keep mine with me. I'm constantly washing my hands with that. And also the last, but probably the most important thing is you definitely want to wear a face mask. And that's whether you're vaccinated or not. If you're indoors with other people or in areas where there are multiples of people, you need to be wearing a mask, even if you're vaccinated. Again, this virus is much more potent. It's much more smart. So we need to take care to do those things that we know are important. And one other thing that I would share, Natalie, related to vaccination, because I do think it's important. A lot of folks have the misconception that if they get vaccinated, they can't get COVID. So we've never said that message. What we've said is the 95% efficacy of our vaccinations, of our mRNA vaccinations, for instance, those, what that means is that it really lessens your chance of getting COVID, number one, but also we're trying to prevent the severeness of the illness. So should you get it, we know that the majority of people, if you've been vaccinated and you get COVID, that in large part, those persons are much less severely affected. So much less likely to have to be hospitalized, much less likely to have to be in an intensive care unit, and much less likely to then have to need a breathing tube or to even die from it. So when we think about what we're asking the vaccine to do, it's to really limit those really, really bad outcomes And we do know we're seeing that in our hospitals. We're now, we're calling this current surge, it's the surge of the unvaccinated, because the majority of patients who are sick enough to be admitted to the hospital, it's not 100%, but the majority, or 85% or more, are those who are unvaccinated. So that's really critically important. And we're also seeing younger and younger people who severely affected. And so for our community, that's important, especially because we feel sort of invincible, right? When we're younger, and we do. And so that is really a myth. We are definitely seeing younger patients. Our largest patient population right now in our healthcare system, not including the children, is really in that 30 to 39 age group. And by far in large, the majority of patients we're seeing are under the age of 60. So in that first initial surge 18 months ago, it was patients who were 65 and older were at higher risk. That's not what we're seeing now, because remember, a lot of our seniors actually got vaccinated, right? They were the initial group outside of healthcare workers who could get vaccinated. So a lot of them took the opportunity to protect themselves and to protect their loved ones. And so we're not really seeing as many in that age group as we are in the younger populations who really didn't take the opportunity to really protect themselves, their loved ones, and their communities by getting vaccinated once it became available to them.
Yeah, so that's her way of saying get vaccinated.
Saying, take action Tuesday, get vaccinated. It is critically important. And I do think that, we have to address and recognize why some people don't or can't. There's a small population of people who really cannot, for a variety of medical reasons, who talked it over with their physicians. And so we don't want to be cavalier or callous. We want to have compassion on those who really can't, as well as those who might not have the correct information. So we're really asking our community, if you've been hesitant, or if you've been avoiding, or you've really been apathetic, to please reach out to medical professionals, reach out to us at Memorial Healthcare System. There are many other systems around, but we are particularly with our community and trying to make sure that we're educated. Please seek out correct information. That's really important. Seek out culturally competent information, so that and cultural competence is not really about color. It's about understanding who you are, where you are, and let us help you where you are, so that we can get to where you want to go, which is really surviving and thriving, right? And so you want to make sure that it's correct information, it's culturally competent information, as well as compassionate information. And so those are some things in Memorial Healthcare System. We want our community to know that if they have questions about vaccines, COVID vaccines, that they can contact us, and we will spend the time necessary to educate and inform and make sure that our customers, our community, makes those informed decisions. And I think that's really critically important, so that we don't have really what we call vaccine regret later, which is where people said, gosh, I wish I'd gotten it. Can you give it to me now? Well, when you're in the intensive care unit right now, no, it's really not available to you right now. So we want to make sure, I know, whole families that have been affected by this, really seriously affected by this, and whole communities. And this is something that absolutely can be prevented. And so we're asking the community to really partner with us, to show us some love as well, like we have shown our community over the past 18 months, and help us really to fight this in the best way that we know how. Again, following our CDC guidelines and recommendations, but also vaccination, because we do know the science is there and it does work.
That's awesome to hear. And so we only have probably a few minutes left, but can you touch on the impact that the virus and this Delta variant has had on communities of color? And we had talked about, the older community or more seasoned community, and sort of how they went and got vaccinated. But what about our communities of color? What is that looking like?
Oh, it's really, it's disheartening. We knew from from last summer and all of the literature that came out that unfortunately, communities of color, African Americans and Latino communities were disproportionately affected, in large part because of many of the things that predisposed people of color to get COVID or get it more severely we see disproportionately in the African American community, like hypertension, diabetes, chronic kidney disease, which is a huge one, sickle cell disease, which not only affects us, as African Americans, but also in our Latino communities, as well as obesity. And so those things really predisposed us in our communities of color. And so while we, made only a smaller percentage of the population, we saw a huge disproportion of our people not only affected by COVID, but affected severely and dying from COVID. And so if you fast forward now 12 months, we are unfortunately seeing the same thing. And it's not all about, the social determinants of health as well as the medical issues. It's really because a lot of it has to do with we're seeing lower vaccination rates in our communities of color. And one of the things that I would want to share, and I heard recently doing a program with my colleague, one of my colleagues from Miami, and she made this really valid point that a lot of times in our communities of color, people are hesitant to be vaccinated because they hear about the Tuskegee experiment. But if you break down really, the whole Tuskegee experiment, this was not, something that the government gave these persons. They had a condition, they had syphilis, but the tragedy was for Tuskegee was that once penicillin, like a simple thing like penicillin, became available and we knew that it was effective against syphilis, that medication was withheld from those persons who they were studying. But now we have a vaccine that whether you're white, Black, whatever your religion, you're Hispanic, whatever your color, whatever your gender, whatever you aspire to be, if you're 12 and older, it's available to everyone. So it's kind of like this, juxtaposition. Tuskegee that people talk about, medication was withheld. We now have the most effective that we have in terms of treating or preventing this, which is the vaccination. It seems quite odd that people were saying, no, I don't want it because of, what's happened in the past. We cannot take away what happened in the past, but let us not be the ones to say, I'm not going to take it when we're offering it for free, but mind you, it's free. When we had brothers who died from this and their families were affected from, the whole Tuskegee thing because medication was withheld. So let us not blame Tuskegee where medicine was withheld and be the same people, right, who are saying, oh, Tuskegee, but then we withhold it from ourselves, which not only affects each individual, it can affect your family. It can affect the whole community. So when I heard that, I was like, oh my gosh, how powerful is that? So we want, people to recognize that, what happened before, it did happen. But let us not be like Tuskegee number 2.0. Where we then withhold it because of what we're holding on to the past. We want to move forward. We want to move forward in health. We want to move forward in prosperity, but we want that to be all of us. And this is absolutely available. And the vaccine that I took personally is the same vaccine that they're giving my other brothers and sisters of other nationalities and ethnicities. And so we want to be mindful of that I'm not getting something that they're not getting. We're all getting the same thing. And I think that's important.
No, that's a great point when it came to the Tuskegee experiment. Like that is an unbelievably great point. Yeah.
And we ought to talk about it more because that's, we don't want to be the perpetrators this time around.
No, that's so good. I'm going to use that story because that's so good. I got to tell everybody that now. Oh my goodness. And I think that's what Take Action Tuesday is about, right? What can we do to help the situation? We've broken down what's happened, why it's happened, who it's impacting. Now, what are we going to do?
So I think what we first need to do is recognize that we're in a fight, right? And for us as people of color, we understand fighting. We understand, fighting for rights and just fighting to be considered a whole human being, right? So we understand what fighting is. It's time to fight. And the ways that we do that are an awakening in ourselves to recognize that we're fighting personally, but we're fighting corporately. And the best things that we can do, all of us have our moms, our grandmothers, our aunts, whomever it is that you fight for, your kids, in addition to yourself, that makes up your community. So we need to really bridge some gaps, especially, let's say, for our younger kids who are now going back to school, who can't fight for themselves in the way that we can as those who are 12 and older. So we really need to be considerate about others in this fight. We need to really be serious about that. And one of the ways we do that is going to get vaccinated. I also want to say that, and I want to remind people that, yes, that anything that we do, medicines that we take, vaccinations we get, not just COVID vaccine, but any of them, there are side effects. So we don't want to paint a lily picture of what's not truthful. But I will tell you, it's a risk benefit that we need to apply, that the risk of getting COVID, especially this variant, the chances are much more likely in terms of people of color being affected, but also being affected severely and also dying. So we need to weigh the risk of getting the vaccine versus the risk of getting COVID. But the benefit of getting this vaccine really far outweighs for the majority of people those risks. I also want to make sure that people do this in tandem with their physician. So have a conversation, particularly if you have specific medical problems or conditions. But what's interesting, and this is one of the things that I share, at the beginning, when we were first starting to talk about vaccines, there were many more groups of persons who doctors felt like shouldn't get it. But the science now being what it is, those same physicians, if you have cancer, you're getting treatment, you have certain autoimmune disease, they're like, oh no, because you're going to be at higher risk if you get this. So they're now recommending get vaccinated, even pregnant women. The American College of OBGYN and now the CDC has followed, which we're ecstatic about, because I don't think I said earlier, my background and training is as an obstetrician gynecologist, but they've now women absolutely need to be vaccinated, because when we started this journey with the novel virus, even though pregnant women were at higher risk, we didn't see the severity of illness that we're seeing now. The Delta variant is taking people out, and unfortunately, that includes pregnant women. So we've now said, no, not only should they have the option, we've come out as a college and said, no, they absolutely should get it. So those are some of the things that we need to recognize. And so we want to make sure that people are aware of the changing information. It's not misinformation. It's just that, just like this OB story I'm telling you, in the beginning, this is what it was. Now we know the science is following. Similarly, for those who've been vaccinated, stay tuned regarding boosters, because we're now expecting by the fall that certain groups of people will be eligible, or we will be recommended to get boosters, particularly if you have some immunocompromising conditions. The CDC has come out with that. And then also for those of us who were vaccinated, with the initial wave, they're looking at, I read a news story this morning, an article this morning, they're looking at whether we should be vaccinated come this fall. So stay tuned. And again, if you need information, please contact us. And the last thing that I would say, outside of following CDC recommendations, for our community that does unfortunately contract COVID, we want to know that we're here for you and we're partnering with you. So it's very important, again, if you have learned that you have contracted COVID, please reach out to your healthcare provider. We are in our healthcare system, and others are as well, but it's not all. We do provide monoclonal antibody therapy and in an outpatient basis. And a lot of people don't know about that, but what monoclonal antibody therapy is, it basically takes some of the antibodies, these are man-made, and it infuses it back, sort of like a transfusion, into patients to give them a reaction so that it helps them to fight the virus. For patients who are on the inpatient side, we used to use a different kind of pooled antibodies called convalescent plasma. But in the outpatient world, we're using monoclonal antibody therapy, and it can really benefit those who are most at risk for developing severe COVID. So if you've not heard about it, please Google it. It's monoclonal antibody therapy. We do offer it within the Memorial Healthcare System. There is a time limit, so it's very time sensitive from the time that you had symptoms or were diagnosed. So we ask that you contact us immediately through Memorial Hospital Pembroke, and we will try to get that information. There are specific criteria, but it is a therapy that is being utilized that it has been really shown to have good results for patients to try to prevent severity of illness. And that's one thing that unfortunately has been talked about a lot in our community that we want our community to know about.
Oh man, this is such good stuff. I'm glad we doubled back to make sure we got this information.
Right? We said that from the
Yes. This is so good. So, Dr. Todra, just thank you so much for coming on here, for being persistent, for sharing your depth and wealth of information that you have available to help us to understand this a little bit better, right? And then to help alleviate some of the fears we may have and understand what we need to do in order to not only help ourselves but our families and our communities to be better and to get over this, at least to be able to get through. I don't know if we're going to get over it, but get through
Get through this
virus.
and to get stronger together,
Yeah.
and together. And so, Natalie, thank you so much in the YWCA and Take Action Tuesday for having Memorial Healthcare System be represented. We have partnered with the community, daily almost, but we are available to our community. We want our community to know that we're here, that we're serious with them in this fight, because it is a fight. But, each battle comes, but we're trying to win the war. And so we're going to keep our eyes on the prize, and we're going to stay the course in this marathon. And so thank you so much for having us to be able to share these important tips and facts for our community so that we can do this together.
Thank you. And thank you for joining the YWCA, where our goal is to eliminate racism and empower women. Have a wonderful day.
Thank you. Awesome. Thank you so much.